My always first thought is, how can I help? What can I do? What can make it easier on everyone? What are my options here? What are my resources? And then just trying to apply those into the situations that come up.
I feel we share the same value in that we want to serve our community by making access to, in my case, contraception as easy as possible. And he was the first who was willing to deliver it to the hospital.
Was kind of the missing part to their puzzle while they were trying to launch it over the past few years. So I was able to set up with the clinical nurse leader over in the hospital and the gynecology team upstairs an IUD reimbursement and stock exchange, if you will. And then it gives the patients the option at the time of their appointment to decide whether or not they want one. It's right there, so access has gone through the roof.
They can access what they chose to have in a very timely manner without having the runaround themselves to get it and then possibly not having access to it at all.
The last few years have been really kind of exciting in the pharmacy space. Pharmacists have been able to do a lot more. A big part of what I've been doing here is when they allowed us to do the drug administration or the injection administration. Some patients just aren't comfortable doing it themselves, or they don't have someone who's comfortable to do it for them. A big part of my practice here is for the long-acting antipsychotic injections. So I had to organize with the rep, and we did a full kind of CE dinner and learned those other injection sites. That was kind of fun planning. I really felt like I was kind of flexing my muscles, stretching, growing what we're able to do as pharmacists.
I think Taylor's been great for working with like a diverse population that we deal with all the time, sometimes a marginalized population, and he's been an excellent resource.
Either if there's a stigma of going into the outreach mental health offices, if it feels more comfortable to them just to come to the community pharmacy, having those patients come in on kind of a monthly basis, I'm able to grow more relationships with them, which is always wonderful to see. And I'm able to help them just be more independent and avoid some of those places where they might not want to go.
He's really patient, and that's what you need sometimes. Sometimes with our clients, it might take 2 or 3 times to kind of for the interaction to go well, and he's willing to put in that time and effort.
And it's been phenomenally successful. Over the past month or two, see several coming through per week, even multiples in a day, and just knowing that those might have been patients that missed out on that previous to having this program available.
I think for the clients, putting their needs at the center and kind of their perspective at the center is really helpful.
I think being a bit creative in this environment is helpful. It just makes for like a more positive experience. In healthcare, it's rarely that positive. It's always we're a little bit sick, something's going wrong, something's happened. So if we can really make this a motivational experience, I almost take more of like a coaching approach and just really kind of allow them to take control of their health and kind of empower them to take that control, and that helps with my patient.
I feel very, very fortunate that he is here in this pharmacy and that we get to work very closely with him.
It's really great to see that he's won this award, and I'm very proud of him.
He's an excellent pharmacist. He's kind of a nice person, and he's got great hair.